I'm David Mason, the Director of Public Health, and we're doing the Delta Wave PSA number 5. Number five, and with Chief Burke. And today we're going to go over the status of cases in town. We're going to talk about flu vaccine and the COVID boosters, because we had a meeting about that. And we'll give you a little idea where we're going with that. And then to talk about the testing and the businesses in town that have been reaching out for testing, and the testing being provided at the fire department. And we're going to have a discussion regarding protocols for COVID, targeting, what's required, discuss a little of the school, just to initiate that conversation, and we'll go from there. So, Chief Burke, let's start where we're at with the cases in town here.
All right, thank you, Dave. So we're at 59 cases active today. We were up to a high of 100. We've been able to peel some people off of the quarantine protocol. So we're at 59. Hospitals are still in the mid-teens, which is good. And again, remember the highs for hospitalizations were in the 60s, and highs in town for numbers were just north of 200 back at the peak. So, we still have a decent amount of cases, but we're not where we were during the peak, which is important, and we want to maintain that.
But I'd like to point out too for Joanne, because the public health nurse, Joanne Gake, as far as there's the appearance in the general public that, it's just a minor cold type situation, and what we're still seeing a number of cases. We're still seeing a level of hospitalizations. We've had a death in town, and I think as far as the situation is still occurring. I mean, there's a lot of work behind the scenes that you're not seeing that is still occurring. And we'll talk to some of that as far as the testing that's occurring that Chief is doing and at the fire department, and for the number of cases and the contact tracing. There's a lot still going on. So to think that everything's normal and it's kind of a minor issue at this point, we still have a lot going on. So let's jump into the testing. What do we have going on?
So a couple things with testing. The Beat COVID initiative, so business employment assistance testing through the chamber, which we announced in May, has been successful so far this summer, going into the fall. If you're any business owner in Sandwich that has a business that needs testing, reach out to Dave or myself, and we'll coordinate testing at the fire department. We've tested over a dozen businesses so far. We've helped them out over the summer, and the goal of the program is to keep businesses open, not to shut them down, and to promote and continue economic recovery due to COVID. So the Beat COVID initiative, testing-wise, is going very well. And again, if you are a business owner in town, reach out to Dave or myself. If you have any concerns, it could be surveillance testing, it could be symptomatic testing, but we'll be able to take care of you, through that initiative at the fire station on Cotuit Road.
But what we don't want you doing is, there seems to be still some level of hesitancy. If I get my people tested, am I exposing myself? Am I going to have to shut down? And what our experiences have been is if there's been any indication some of the businesses have been forward and they catch it sooner than later, it actually gets it under control a lot sooner. You may lose an employee or two, for a time period based on the test results. But if you disregard that, continue it, and then all of a sudden it becomes overwhelming, you may have more cases that results in shutting down at that point. And we've seen that in a couple scenarios.
Well, and you look at the Red Sox. Let's go to the Major League Baseball. They have 13 people. They're calling people up left and right, and they have pretty robust testing protocols. So the sooner we can get it, the better. Isolate them. If they're vaccinated people that are around these folks, the protocols are a little lenient at that point, and get back to work quicker. So, if there's any question at all, that's what we're here for. The testing, that it's free, I think is important for the businesses, because some business owners are paying to have their people tested. That should not be the case. I've said that from day one, 18 months ago, that testing should be publicly supported and free. and people will take advantage of it. We're not asking for insurance information. We just want to test and make sure you're okay and to keep your business open and functional.
Because the more you prolong it, the greater the likelihood that you're going to be closed longer.
Correct.
Instead of, and so we're encouraging people to catch it right up front.
Yep,
so,
agreed.
No, so we've had, because you just recently did something like 14 people for a business that came through, and it worked out well for them.
They were all negative, which was good. There was a concern.
They did have some positives.
They did. They had some positives, and I think they wanted to make sure that everybody was good, and we were able to get on it, fairly quickly. And I think it's important for people, the business owners, to realize if you reach out to Dave or I get an email on a Friday afternoon, that doesn't preclude you from being tested Friday night or Saturday morning.
Right.
I think we look at the numbers, what the exposure is, we kind of march out the days. If you were exposed yesterday, it's not necessarily prudent to get tested right away. We got to let 72 hours go by, but that's been one of our biggest things, is to support our businesses in town here and to keep them open and promote economic recovery, and that's what we are trying to do with the initiative with the chamber.
Agreed. So let's give us a call even if you have a question. We can answer those questions for you quickly and give you some guidance on which way you should go with it at that point. And then we also met with regards to this morning with Joanne, the public health nurse, regarding flu vaccines for the upcoming flu season, and also a discussion of COVID booster shots in anticipation of that. You want to outline some of what we discussed there, Chief?
Yep, so we're still waiting for the flu vaccine to come in, at least the allotment that we've been given. So our tentative plan is October will be flu shot month, and November will be COVID booster. Now, we had a discussion. We did the wing school last year. It was very successful. Just a couple of concerns I have is weather. We had good weather last year, and what I don't want to have happen is a significant weather event comes through like we had last week, where we have to cancel because it's all outdoors. So I think what we're going to transition to, and it's part of our planning process, we have multiple layers of plans, is we're going to go back to the Human Services building, Joanne's office, but we're going to have a mobile option. So you'll come in, those that are ambulatory can walk, will go in and get their flu shot, and we'll have plenty of stations set up inside. But if you're somebody that's mobility impaired, you can be checked in the lower parking lot, and then the firefighters will give you your flu vaccine in the lower parking lot, so you don't have to get out of your vehicle. So it's a hybrid drive-through, but we're utilizing familiar territory for people in a process that we've really executed very well over the last 18 months of utilizing that space. So that's our plan, and we're going to follow a similar plan for the COVID boosters. Same location, same type of setup. So we'll try to make it as convenient as possible, and the COVID boosters will be Moderna. I think Joanne has confirmed that. So
yes.
It'll be a Moderna
and that's
booster.
The majority of what we provide the community, so we will be going the Moderna route, and that's why we're pushing it into November after the 8 months that they're recommending as far as a booster shot, and in terms of timing of Moderna for that booster shot also, because Pfizer's received it, we're a little behind, Moderna's a little behind, but they will catch up. So November provides the perfect time frame for that. And just as far as for the use at the Human Services building, mobile impaired, let's define that.
Yeah,
right
so
now.
if you're somebody that's wheelchair bound or utilizes a walker or has a handicap placard on their car, these will be the identifiers, and we can do the basically the in-your-car mobile setup. Everybody else will be able to park up at Human Services and walk in, and again, the same type of format. And again, the other thing to mention is when we were doing this last year, options were limited for both vaccine and flu shots. I think there's more options on the table now, so we'll be happy to, and we'll let people know what the sign-up process is going to be and how that's going to play out. But you do have other options too for flu vaccine and for boosters that you did not have last year, so you can plan accordingly.
Right, and there'll be adequate supply also. It's
Correct.
not a supply issue for the flu, so there's no need to make a run on that. So we will be, Joanne has ordered enough to cover what had occurred last year plus. So we are all set for that at this point. And then just a quick discussion of the protocols as far as some of this may be considered like an editorial, at this point, but some of it, I think what's occurring out there in the public, and I'll speak to Joanne, myself, the testing with the chief, and as far as what occurs with that, and with the schools, that we're working by, and I won't really get into the weeds of it, but we are all working by a set of guidelines that are provided to us from the Mass Department of Public Health, the manufacturers of whatever tool we're utilizing, like the test kits, and the Department of Elementary and Secondary Education. I mean, the schools need to adhere to what guidance is being provided from them for decision-making process also. And there appears to be sometimes the thought in the general public that somehow we're just making up rules as we go, or somehow they're our rules. Again, they're state rules, and we're required to implement them, and the guidances that we're following are set by the Mass Department of Public Health, Department of Elementary and Secondary Education, and it's not like we have the ability to vary from that. So I know there's been a level of anger directed at those authorities in place, Joanne, myself, the superintendent, her staff, and that frustration is misplaced. And we're looking, and we're going to be providing in the near future some more information to you as far as how, one, what we're required to follow, so you have a complete understanding of that, and two, how to better direct your energy in this issue, or if you have issues. All of those decisions are being made up at the State House at this point, and as far as, or the State House's staff agencies. So, really you need to look at those areas as far as, one, understand the basis of where the requirements are coming from, and then know how to direct your energy or frustration to those. I mean, we understand with the schools, right now there's a number of kids out at the schools. I want to say there's, approximately 30 in the system, that have been removed because of the protocols in place, and I know there's frustrated parents with that. You know what? They're following the rules. Don't take it out on them. There's choices being made here. As far as you sending your child to school, there's no ability to do remote learning because the governor took that away, or, as far as a state decision on that, that remote learning does not add to your educational days, so it's not an option. And we'll discuss more of that in the near future with the superintendent, Pam Gould. But you're misdirecting your frustration and anger at these people, and those people who are trying to give your kids a good education also. So I strongly suggest you educate yourself on the process. Is there anything else you want to add to that, Chief?
No, I'll just add the remote learning. I teach remote learning part-time at Boston University and have since 2009. It's a great tool to use, and it's, when you're in this type of disaster mode or emergency mode, you want to have options.
And keep all your options open.
Keep all your options on the table. And this is just me personally, the remote option removal surprised me, because I think it leaves you a little short with options, potential options. And if it's about educating the kids and giving them the best education possible, a lot of kids thrived with remote education last year. Is it optimal? No, but it is an option. And I think, I would like to see at least that back on the table, with the ability for parents to be able to utilize that if their child is home for whatever reason, whether it's quarantine or they're COVID positive or whatever. I just think down the road, it's a longer term play. When COVID's over, you still have the ability for remote for the next thing that happens. And that's just my personal editorial. I think that should be looked at very strongly. And should be put back on the table. I understand why they did it.
And they being the state.
The state, correct, why they did it, but you do not limit your options in the time of crisis. You only expand them and keep them on the table, and that's what I would like to see.
So we'll have a discussion with Pam Gould, the superintendent of schools, in the near future here to kind of outline the guidance documents, where you can find those guidance documents, and how they affect the schools and how they affect you. so that you understand, as far as why those decisions are being made, so you're not taking out on the people that are just responsible for implementing them. So I think we'll wrap it up there.
I think we're good. There'll be more, like I said, more coming. October is flu month. November will be COVID booster month, and more information coming. And again, we're going to utilize Human Services Building, and we'll advertise in these PSAs and outside of these PSAs how to register for that and what that will look like.
So those vaccinations we're offering roll you right into the holiday seasons.
Correct.
With family members, keeping you safe, keeping your family members safe. And again, regarding COVID vaccination, it's readily available. At your CVS's, you can go online, mass.gov. There's numerous places available. It's not like it was back in the early parts of the vaccine distribution. It's readily available. We're aware of all the people that have said, do you think I should get vaccinated now? It's like, make that decision. It's out there. Those who are being vaccinated, that we are seeing breakthrough cases, are experiencing milder symptoms as opposed to those who have not been vaccinated. So those who have not been vaccinated are having a more severe reaction at this point. So be informed and be educated about the decisions you're making. So, and we'll wrap it with that.
That'll do it. Everybody stay safe.
Thank you.